Hi, Smart News. Happy Wednesday. We're going to do something a little different today. We're going to do a news report / news commentary. And I think they both work together, and it's really critical to talk about this story now because I think it'll inform you for the next several weeks. Give you some tools for when you see headlines beyond the ones that you see on Smarter News to kind of help you understand the part of the story that we're in. At least it was helpful to me in preparing this for you. So, by the way, if you all just served as my producers, like, we'd have great programming because you send me the most interesting articles. And it actually was one of you who sent me a New York Times article that got me all fired up and motivated. And then I did a little research, calmed myself down, and here we are doing an Instagram Live. So it all works out. So what we're going to focus on today is what's happening with the COVID-19 pandemic. That's all I'm going to talk about. And the reason why I think it's important to talk about today is that you're starting to see, which is actually sort of this gruesome chase of headlines, because there's a question about when we will in the United States pass a threshold of 700,000 deaths. Those numbers in the news, certainly they're a milestone, but we have to remember that each of those numbers reflects the loss of someone's life. And I don't want to lose focus on that, even when I'm going to be talking about some of the numbers today. So there are some data sets that may show that we've already crossed that. There are others that say that we're almost to that point. I think it's an important time to reflect on, remember when we thought, well, will we ever pass 200,000 deaths? And here we are. So before I show you the article that got me all fired up, I want to show you a model. This is a model that I've referenced since the spring of 2020. This is not a crystal ball, but this is a model that's been put together by the University of Washington that's referenced by health officials worldwide. And you could have access to it as well. And so I like to go through it so you can see what health officials are seeing and also kind of poke around, see what's going on with this pandemic. So let me go ahead and flip the camera. It's always like this awkward point of view, right? When you flip the camera. Let me go ahead and flip the camera. All right, let's get the glare down and let's dig in. So this is a look at the United States of America. We're starting in December of 2020 here. Here we are just at the beginning of this year. And this is the way that deaths are looking in America at this point. So I want you to look in this maroon line. This is the projection right now to see over 700,000 deaths by January 1st. So this is where we are today. The trend is continuing upwards, which I think is important. Here's the worst case scenario, and here's a better case scenario according to the researchers here, which would have to do with more universal mask wearing, okay? Let's go down here to daily deaths. This is an important graph as well. We remember that deaths really, really lag cases. So a lot of this is going to be uneven and takes a little time to sort of even out what the data is. And what I mean is, sometimes it takes a while to report deaths and then to attribute them to COVID-19. So here we are back in January. Here we are right now. Here's what the projection looks like. So you're going to see a little bit of a dip, they say, but then it's going to come back up. I want you to remember that point in a little bit. This is worst case scenario, better case scenario. Let's go down one more. This is vaccine coverage. This is a new part of their model. The light green is for those that have at least one dose. The darker green is for those that have fully vaccinated. And you can see for the country, it's over 60%. So that's where we're at right now. This is more or less where the model ends. You get hospital resources, some infections and testing. It doesn't chart those with prior cases, which I think is really important as we're taking a look at this story now, and I'll explain that in a moment. But this is kind of what does it look like now, and again, where is it looking like in the future? So that is from the University of Washington. I'm going to put that underneath our video on our website so you can poke around. You can actually break it down according to region and wherever you are in the world. It's very helpful. So what was the article that fired me up? All things considered. One of you wrote me and said this was, you're not going to be able to see it as well. This is from the New York Times newsletter, and the headline is Red COVID. So it says Red COVID, and it's COVID's partisan pattern is getting more extreme. And what the New York Times is looking at is what they say is an emerging pattern when it comes to COVID-19 in America. And that includes, and I'm going to try to just briefly explain it, what they're saying is in areas of the country that voted at a higher percentage for President Trump have a lower rate of vaccination and therefore a higher rate of death. And they're tying this to partisan persuasion. They're saying those in areas where there was people that voted for President Biden have a higher rate of vaccination and a lower rate of death. And so they're examining this. I want you to pay close attention to this sort of graph. You can see the area like Texas and Mississippi, What's interesting about this report is that it doesn't take in other variables. So let's just take a look at what's going on. When we say red states, blue states, what are we talking about? This is sort of what the political makeup of America looks like. I want you to keep that in your mind because I'm going to show you a different map. Remember, the New York Times is saying in these particular areas that are red states, there's more of a higher rate of death. Well, let me show you this. This is new from the CDC. This right here is a map looking at obesity in America. So you can see states like Texas and Mississippi and Alabama, solidly red states, have higher rates of obesity. These are also places where there's higher rates of COVID deaths. Now, I don't have the team that the New York Times has, and I'm sure that they've dived in at a certain point, I would hope, to obesity rates and a connection to COVID-19 deaths. But it's the fact that they were focusing just on the politics of this moment when we're at this critical point of 700,000 people dying that just points out why I feel so compelled to dedicate my time to Smarter News, because we have to open up the story and ask more questions about what's going on. So let me show you what the New York Times own data suggests. Here's something that's interesting. These are the hot spots in America as of this week. So you can see, look to the south. Deep red is where it's really hot. Look at the south right now. You're not seeing as much deep red as you're seeing in the Northwest. An interesting trend, isn't it? Let me show you again another part of a graph the New York Times has. Again, a great resource I'm so grateful for. The green map is vaccination rates. So the darker green is higher vaccination rates. I just want to point out that you're seeing some darker green sections in the areas where you're continuing to see also higher rates of cases. This is not saying a judgment call on the vaccine or not. I just want to show you this. And the reason why I want to show you this is this latest graph. Hopefully we can see it. So let's just sit here for a second. Last year at this time, you can see this is COVID cases related to region. You can see last year at this time, whether it was the West, the Midwest, the South, or the Northeast. The Northeast was very low, but you see in the last year's section in August, you can see a rise of what was happening in the South, a little bit of what was happening in the West and the Midwest. If you look at this year, you can see that the pattern is more exaggerated. The South, again, had quite a peak of cases and deaths. We saw that. We do see also in the other regions, you also saw an increase, but not as exaggerated as the South. There's a real story in the South. Vaccination rates may be part of the equation, as we've talked to health experts here and doctors who continue to say when it looks at critical care, the people that they're mostly treating are those that are unvaccinated. That is exactly what my reporting suggests. But I still want to show you these different sides. What I actually want to focus on is November and February, because now we're going to get another year of data. So yes, we've seen blips over the last several months in the summer, specifically in the South, just as we did last year. What's going to be most important is what we're actually going to see November through February, because that's when areas that were hit hard in the past, like the Northeast, again had a huge rise. If this pattern repeats, it will really give us some insight. Remember, we're not just looking at cases, we're looking at what cases turn severe and ultimately turn to deaths. So if we see this sort of pattern repeat during flu season, and we see it repeat all over the country, we're not only going to be watching cases, but we're going to be watching deaths and whether or not we can reach any conclusions because of this repeat of a pattern. Is it regional that we're seeing more severe cases? Is it because of vaccination status? Is it because of pre-existing conditions? These are some really important questions to ask. And again, we want to watch for this particular time period. But as we're waiting and watching from that, I just want to go back to this one particular picture because I think this is really important. There's so much debate about who's doing the right thing and who's doing the wrong thing when it comes to COVID-19. But this map tells us something. You're not seeing any areas that are huge swaths of white that are not hotspots in America. Really, the whole country remains a hotspot for COVID-19. And this offers us some humility and some perspective, because if anyone truly had figured it all out, we don't see it yet. We may see it in the future. We could see it in the next 6 months. And when we do, I'll be really happy to point that out to you so that we can all stay safe and healthy, which is ultimately the goal. So getting back to this, is a partisan pattern truly emerging? Is it a seasonal pattern, a regional pattern, a pattern of pre-existing conditions? Remember, the vaccine has only been available widely for everybody for 6 to 7 months. So is it a pattern of vaccination? Has enough time passed for us to really notice any conclusive pattern? The New York Times can be right. There could be a trend there. Absolutely. The question that I have is, editorially, is that the question that we really want to spend all of our resources on? And that's where I'm at today. That's all. All right, guys, questions and comments, as always, let me know, and more on all of this on smartnews.com. Have a great day. I'll talk to you soon.